tens of thousands of businesses have closed across the country, hundreds of thousands around the world. Tens of millions of people are unsure about their financial futures and facing economic crisis. Millions and millions and millions of people are already without jobs. The cases of COVID-19 around the world are just now beginning to plateau. If we don't follow the health and safety practices set in place for social distancing, we could find ourselves headed straight towards another lockdown, and our national and global economies cannot face another one of these. In order to maintain the plateau of viruses, help these cases continue to flatten and dwindle, and help our national and global economy, we need to follow social distancing guidelines until a vaccine can be successfully created and administered to slow the effects of this and keep us safe. Those who oppose the current lockdown and who believe it to be an infringement of their basic human rights do have a point. According to the Fifth Amendment in the Bill of Rights in the United States Constitution, it states that no person shall be deprived of liberty without just compensation. The stay-at-home order and social distancing is causing all of us stress, but this stress is nothing in comparison to the stress of losing a loved one due to COVID-19 or becoming sick yourself. I'm an essential employee. I've been allowed to stay at work. It's a blessing. But through work in my small business, I've been in contact with other people in both small and large businesses who are very unsure about the future of their businesses. They're worried about their employees. They're worried about themselves. They're worried about their businesses staying afloat, period. We need to help our businesses. We need to stay home and stay safe. To help you understand fully why this is so important and why we need to keep adopting these practices and holding them dear, we're going to talk about how this economic impact has already affected us here in the United States. We're already going to talk about how this virus affects us even after the infection has been overcome. And we're going to talk about how this lockdown has already possibly affected our economic future. According to Andrew Lisa of The Stacker, holding company Berkshire Hathaway, which owns a major portfolio of big businesses containing not only Geico, but Duracell and other large names, reported a $49.7 billion loss in this quarter alone. Also, according to The Stacker, there are more people unemployed now at a national 32% than there were during the Great Depression and the years afterwards, where it was about 25%. This is about 1 in 3 people in the United States that's unemployed right now. According to Jack Rasmus, author of Epic Recession, Prelude to Global Depression, in terms of unemployment levels, in an economy the size of the U.S., epic recession occurs when the unemployment rate is above 10%, or when 15 million or more people lose their jobs. Now we're at twice both those numbers, even more than that, and in less time than it took to reach the worst stage of the Great Depression. Now that we know more about how the virus has already impacted our economy, let's learn about how it affects our bodies even after infection. As some of you know, all our friends, neighbors, and family who have pre-existing medical conditions like diabetes or asthma are at risk of developing twice the severity of conditions as normal, healthy people. They're twice as likely to develop severe conditions. According to the medical journal Res Cardiol, doctors have concluded after a series of tests involving 1,527 patients that patients with previous cardiovascular metabolic diseases may face a greater risk of developing into the severe condition, and the comorbidities can also greatly affect the prognosis of COVID-19. On the other hand, COVID-19 can, in turn, aggravate damage to the heart. Following infection from the novel coronavirus, COVID-19 has effects ranging from temporary to lasting, but the lasting effects are real. They are. According to medical expert Panagis Galiatsaros of the Johns Hopkins Bayview Medical Center, as COVID-19 pneumonia progresses, more of the air sacs in the lungs become filled with fluid, leaking from tiny blood vessels that are in the lungs. This can lead to acute respiratory distress syndrome, ARDS, which is a form of lung failure. People who survive ARDS and COVID-19 may have lasting pulmonary scarring in the heart. Let's take a look at some information from the BBC network to understand how this is affecting us, at least the population in Great Britain and Wales, in numbers. The red line indicates COVID-19. The blue line indicates flu and pneumonia put together. As you see around here, between March and April, we're seeing an increase in COVID-19 deaths that has spiked to almost 3 times the average deaths that are occurring. It's just over 2,000. We're at about 6,000 deaths per month. This bar graph here is showing the national average for deaths per year in the UK. That's Great Britain and Wales. And this is the amount of deaths that has already happened in 2020. We're already 10,000 deaths above the 5-year national average. It's less than halfway through the year. With an understanding now of how COVID-19 is affecting our health and will continue to affect people who become infected, let's talk about how this crisis could become worse without our compliance for social distancing in an economic sense. If we don't follow protocol, we could face a downward economic trend that could ruin even our strongest businesses. Austin Goolsbee for the New York Times reports that advanced economies like the United States are far from immune, and a broad outbreak of the disease could be even worse for their economies than in China. And this is because of the way that our economies work. We are face-to-face businesses. That's where we generate most of our profit, and those are the businesses that are being crippled right now by this situation. According to David Grusky, Bruce Weskern, and Christopher Weimer, authors of The Great Recession, the effects, the far-reaching effects, are economic fragility, continued mass unemployment, and the risk of a relapse or of a double recession after the 2008 crisis were felt strongly for 4 years after the initial downward spike of 2008. We could already be in a worse trend than that. Look here. This is the downward trend that we're already experiencing in 2020. We're at the all-time national worst economic trends for the last century. This is just almost as bad as the Great Depression in 1929 and a downward trend according to the S&P index, and almost as bad as the 1987 crash. This is courtesy of USA Today. According to the New York Times, we're getting close to worse of a downward trend than the downward trend that began the actual 2008 crisis. That was a 56.8% downward trend, and we're in the beginning of a stage that is worse than that beginning. We need to practice all the safety recommendations provided to us by national and world organizations designed to keep us healthy, to reduce further social and economic disaster, and to prevent ourselves from another lockdown and a crippling world economic crisis. If you believe what you're hearing, be the example. Follow the social distancing, stay at home, keep others safe, bring us back to normal. Other people will see what you're doing, they'll see that you're successful, and they will do it too.